All right, Dr. Emer, you're live.
Hey guys, it's Dr. Emer. We have one of our returning clients who got an amazing result from Sculptra collagen production. So what Sculptra is, you can see it in this vial here, it's a injectable that is more of a powder. So just, Rosa, I need you to be mixing these. Because they're all collagen. So I put them in your hand. And if you see her face is more narrow and she has a little bit of looseness, but I don't want her to look overdone. So we're going to start the tightening process and the volumizing process we've been using with the Sculptra. The Sculptra builds collagen over time and helps to fill out areas like the temples, the mid-face, the jawline. And so when we inject it, it looks a little swollen, then it goes away completely. And then as time goes on, a couple months, we see the building process occurring, which occurs over years. And we've already gotten a really nice improvement even in the initial treatments that we've done. And you can see what we're going to do here is focus on all the areas of lifting. So lateral cheek, and remember, this is not a filler, this is a solution that goes into the skin and builds over time. So it's going to look really full today with what we're doing, but then it's going to dissolve into the tissue and basically tell the tissue build collagen. That's what we want it to do.
Dr. Emer, does this hurt?
It does hurt, I will say, but she is like the strongest woman I know. So for her, it's actually relatively easy. But yes, there's numbing medicine inside. We're using stronger needles. We're actually going along the jawline and superficial planes to build some collagen. I'm also going a little bit onto what's called the piriform aperture, which is the deep part of the nose, and then also right here in the what I call the lower cutaneous lip area to help the marionette lines. And now all we need to do is massage. So we're going to come, my staff is going to massage her on this side, because you can see there's some fluid and it's swollen. We're going to massage the marionette, the cheek, the temple. Now we're going to go to the other side and do that exact same thing, a little pinch into the temple. This is already kind of built out, which is nice.
And Dr. Emer, can you use this in other parts of the body?
We love using this on the knees, on the buttock for volume, the knees for sagging and tightening. We use it for cellulite. You can use it for a lot of different things, combining it with Morpheus for tightening of the skin, which is microneedling radiofrequency. Okay, and you can also combine it with other fillers to give what I call the Bella lift procedure in the buttock area, like Bella fill.
And who is a good candidate for this treatment?
Anyone that wants, yeah, exactly.
She is.
Like her that doesn't want to look overdone with a filler. Anyone that wants to kind of be preventative and actually has patience, because you don't see the result immediately. It's a long-term plan, which she basically trusts me. You know, she doesn't want to leave. She wants to get something where we're building over time. So every time I see her, she looks better. You know what I mean? And then, and that's what we're doing. We're basically doing shaping and contouring of different areas. And like I said, I like along the jawline. You know, women lose a little volume.
And Dr. Emer, quick question. How long does it last?
So this can last up to 2 or 3 years, you guys. But what we try and do that first year is inject it a certain number of times to where we get a really nice result. And then after that, we maintain that result with a once or twice a year treatment. That's it. And then her next step is going to be to do things like threads, lasers like halo, BBL for pigmentation, and then also a little eyelash. And then also Morpheus to tighten the skin. So this is her underlying collagen support. She looks really good. Even now with the swelling in it, we know where we want to go volume-wise. We want to keep her really contoured on the jaw. We want to keep this upturned. We want to make sure the folds stay fine and lifted in the temple and in the cheek area. And then we get into that meeting. So if you're thinking about volume, but you don't want to look overdone with fillers, Sculptra is a good alternative. You have to massage the face a couple times a day for 5 minutes for the next 5 days or a couple days. And that's it. In the long term, we get a lot of collagen production, improvement in texture of the skin, and more tightening.
Quick question, Dr. Emer. Can it go under the eyes?
Okay, I don't typically like it under the eye, but we do use it for the medial fat pad to lift the cheek, which helps the under eyes.
Okay, thank you so much.